Audience member number 1, 2, 3, 4, and 5.
Could you imagine yourself lying in your bed, completely relaxed, petting your dog or cat? Your favorite show was on, and for no reason you have the sudden wave of complete terror fill your mind. This sudden fear or panic attack is something that cannot be predicted or controlled once it is happening. Langenscheidt's Merriam-Webster Medical Dictionary describes a panic disorder as an anxiety disorder characterized by recurrent, unexpected panic attacks, followed by a month or more of worry about their recurrence. So to have a panic disorder, the individual would have to experience these panic attacks almost every day at any given moment. Many of you have some general understanding of the signs and symptoms of a heart attack. Although a panic disorder is not life-threatening, the symptoms are almost identical to a heart attack. The U.S. National Library of Medicine identifies symptoms for panic attacks such as severe chest pain, difficulty breathing, and increased heart rate. These attacks are not to be confused with general anxiety or everyday stresses, such as those you would experience with meeting a deadline or giving a speech. Research also suggests that the disorder is predominantly found twice as much in women than in men. What it feels like can easily be described, but what it actually is and its etiology is very complex. Although there is no clear cause for panic disorders, studies show that family history, major life stresses, and underlying medical conditions may contribute to the development of this disorder. To recognize the presence of this particular mental illness, it is important to understand the factors that influence it. As with all other hereditary medical conditions, we can refer first to family history. The first risk factor is having a family history of mental illness such as bipolar disorder or depression. Unfortunately, most individuals do not recognize the presence of a mental health disorder until the symptoms become severe. However, advances in scientific research and the release of information to the public regarding new studies has increased mental health awareness. Most families are able to communicate openly about mental illness now because of the increase in awareness, so that early intervention is possible. Panic disorder is not limited to genetic factors. Environmental factors also play a role in the development. The website for the National Center for Biotechnology Information states that several studies show that adverse childhood conditions may lead to panic disorder in adulthood. When a child is exposed to alcoholism, domestic violence, or divorce, it increases the risk for a panic disorder. According to an article in the website Help Guide, major life changes such as graduating, entering the workplace, or even marriage can be enough of an environmental trigger. The same article also mentions the possibility of panic disorder being linked to undiagnosed or underlying physical conditions, which we will discuss next. So, is it a heart attack or a panic attack? The first approach would presumably be to rule out any underlying medical conditions before the diagnosis of the panic disorder. But certain conditions can cause persistent panic attacks that lead to the disorder, like asthma, frequent heartburn, congestive heart failure, to name a few. Perhaps the most common condition associated with panic disorder is substance and alcohol abuse. It is not only limited to the current use, but occurs in individuals who are withdrawing as well. And it's important to note that there is an increased risk of suicide in anyone with a panic disorder or any other mental illness, even when the symptoms are not present. It is clear now that while panic disorder is not as life-threatening as a heart attack, it does lower the quality of life, which would ultimately lead to more severe conditions. Being aware of this disorder may help save lives. According to Holly Haslett-Stevens, co-author of the book Practitioner's Guide to Evidence-Based Therapy, panic disorder was diagnosed as agoraphobia and not even recognized as a separate disorder until the late 1970s. Scientists and society seem to just now recognize and accept that this is in fact a condition that should not be ignored. Heidi Coleman really validated the seriousness of panic disorder when she said, "Remember, having a panic disorder isn't a failure, and not having one isn't a success. Success is not letting the attacks ruin your life."
Very good.